Hello and welcome to another MedStar Health broadcast on Facebook Live. My name is Karen Zingle and I'm here today with cardiologist Dr. Nicholas Paivanas and Dr. Daniel Dooley from MedStar Heart and Vascular Institute. It's Heart Month, so we've been coming to you live with various heart-related topics, and today we're discussing another important one, which is heart disease. So if you've been wondering, what is heart disease? How can it be prevented? Then stick around, please share this with your friends and ask your questions in the comments below. Doctors, welcome. Thank you for joining us today.
Thank you.
Thank you. Thanks for having us.
Of course. So before we get started into some questions, could you tell the audience a little bit about yourself?
Sure. So my name is Nick Paivanas. I'm a cardiologist here. I grew up in Virginia, went to undergrad down at William & Mary, and then moved up to Georgetown for medical school and up to upstate New York in Rochester for all my training after that. Settled back here in Annapolis, and I'm loving it here. So I've been with the group now for about a year and a half. Yeah.
Thank
Growing
you.
up, yeah, little kids and a dog.
Awesome.
Excellent. And my name is Dan Dooley. I'm also a general non-invasive cardiologist here at MedStar Cardiology Associates. And I've been here for still within my first year. Been loving it so far. And I did all of my actual training, medical school, residency, and my fellowship all in one place actually at Georgetown in Washington, D.C. And had a great experience there, and I'm happy to be here now and working at MedStar Cardiology Associates.
Great, thank you. So let's get into some discussion. Let's first talk about what is heart disease.
Sure. So, so when we talk about heart disease, I think there's generally a few different things that can be incorporated in that. There's obviously a lot of different parts of the heart that we talk about, but I think that generally speaking, what we're referring to is typically coronary artery disease or blockages or plaque buildup in the arteries of the heart. As well as potential for heart failure, which sometimes and in many cases can be caused by that coronary artery disease. So those are the more common things that we talk about when we're referring to prevention and talking about risk stratification for heart disease. I think that's kind of the general understanding.
Thank you. So can it be prevented?
Oh, absolutely. So there's a lot of things that go into heart disease, and actually going from someone being healthy to having heart disease. There are a lot of things that can increase your risk, so blood pressure, cholesterol, and a lot of different lifestyle things that can make it more likely for you to develop heart disease. By controlling those risk factors, we can really see a dramatic reduction in your risk of developing heart disease.
Okay, so let's talk about the age factor. Why should someone in their 20s or 30s care about heart disease prevention?
Yeah, I think that's a great question. So, when we think about prevention for heart disease, we think about a disease process that really starts early on in a lifetime and takes oftentimes a lifetime to build up to a point where it causes symptoms or problems. So from a prevention point of view, it's really critical, I think, to be thinking about that early on so that you are on top of treating or modifying risk factors. So as Dr. Paivanas was just mentioning, there are risk factors that are modifiable risk factors, and there are risk factors that are non-modifiable risk factors. So those things that are modifiable, like diet, like exercise, smoking status, those are all things that can be focused on really early in life to prevent heart disease later in life.
Thank you. So let's get into that a little bit more. Let's talk about exercise. Why is that so important, and what do you recommend to your patients?
Right. So I tell people that unfortunately there is no alternative to just getting regular exercise. There's no shortcuts with that. Regular exercise just does so many fantastic things for your body. Heart disease prevention, keeping your blood pressure under control, healthy weight, and it just helps in so many other ways outside of the heart as well. And so unfortunately, there's no shortcuts here, but getting 30 minutes a day of some brisk physical activity, I would say, is one way to kind of keep the heart doctor away. More activity is good. At least 15 minutes a day, I would say, is kind of that minimum amount where you start to see a benefit. But usually when I'm talking to someone, I'm saying, you know what, 5 days out of the week, we should be getting your heart rate up a little bit for about 30 minutes at a time. Sometimes people will say that they don't have time to do that. They don't have 30 minutes.
Right.
And then we'll say, well, you know, you've got a step counter, maybe get 10,000 steps in a day. That's another way to make sure that, you know, you're staying active, you're moving around. So those are the general guidelines I tell people.
Great.
Yeah, I think that's a great point, because as we learn more about this, I think there's more and more evidence that sedentary lifestyle is a risk factor that's significant for heart disease, probably even as much as some of the traditional risk factors that we think about, like high blood pressure, like smoking. So making sure that you're doing regular exercise is really important.
Great, thank you. So let's talk a little bit more about smoking. How does that contribute, as being a smoker or even a former smoker, how does that contribute to getting heart disease?
Yeah, so smoking is definitely one of the biggest, again, modifiable risk factors that you can have for developing heart disease. And it has several effects, and obviously can be a risk factor for other things besides heart disease. But the way that it affects the heart, so it can certainly raise blood pressure, and it can cause damage over time to the sort of the lining of the blood vessels, which can lead to plaque buildup, and in a lot of cases can lead to heart attacks and strokes. Which at the end of the day is what we're trying to prevent when we talk about heart disease prevention. So really there's different mechanisms for it, but no question smoking is one of the main risk factors for developing heart attacks and heart disease.
Yeah. And I would say, piggybacking on that, unfortunately it's not just regular cigarettes, you know, all the other alternative e-cigarettes and vaping. Unfortunately, we're seeing more and more that they're filled with a lot of the same garbage stuff that increases your risk for heart disease. So sometimes people use other things, vaping, to get off of cigarettes, which is, you know, it's great, but then getting off the vaping, getting off the e-cigarettes too is very important. Yeah.
And the last thing to say is, I think quitting smoking can be really hard, and it's something that if you've struggled with that before, definitely something to talk with your doctor about, because there are options that we can offer if you're having trouble quitting on your own. So I think that's something really important to keep in mind.
Great, thank you. So let's talk about checkups with your physician. So how important is it to have regular checkups with your physician, and how often should you be discussing these type of issues with them?
Sure. So a lot of this depends on the individual patient. So your age, your other risk factors, your comorbidities, these sorts of things will kind of help to dictate how often you need to see your doctor. For someone who's young and healthy, it might just be checking in once a year. For someone who has high blood pressure, high cholesterol, maybe it's checking in a couple times a year. For patients that have developed heart disease, heart failure, heart attacks, sometimes we're seeing people even more frequently than that. So it kind of has to be individualized, but I would say at least checking in once a year to make sure that there's nothing going on that we need to kind of adjust, we need to tweak, kind of going forward.
Okay, thank you. So let's talk a little bit more about high cholesterol. What are some ways that people can manage high cholesterol?
Yeah, so it's a great question. So really, there's two general categories of ways that people can manage high cholesterol, and I think it's important to keep in mind that cholesterol is affected by several different things, one of which is genetics too. So certainly it can be hereditary among families, but dietary changes and making sure that people are eating healthy diets, which often include high fiber. Certain specific foods have been shown to maybe have an impact on cholesterol, such as like red yeast rice, and medication is the other major category of things that we can use to control cholesterol in cases where diet and lifestyle modifications, like adding exercise, as we've been talking about, doesn't do enough of a job to get that cholesterol level down to a reasonable and acceptable level. So from a medication point of view, certainly we have several different classes of medications that we can choose from if we need to use something like that.
Great. So how do medications work?
Sure. So I kind of lump the cholesterol medications into big categories. Either they reduce the amount of cholesterol that you're absorbing from your diet, or they change the way your body is kind of metabolizing cholesterol internally. And your doctor can help you to select which one is right for you. The most common medications we use, the ones with the most evidence behind them, are going to be statins. That's something that people will read a lot about. And I would encourage you to really talk with your doctor about the evidence behind them if your doctor feels that's something that's appropriate for you.
Okay, thank you. So let's get into blood pressure. So how does blood pressure contribute to heart disease, and what number should you be looking for when you're looking at your blood pressure?
Yeah, so blood pressure also is one of the major risk factors for developing heart disease. And again, as we had talked about in the beginning, that includes things like coronary artery disease or plaque buildup in the arteries, as well as heart failure, which can develop from having high blood pressure that's not well controlled. And of course, strokes also can result from not adequately controlled blood pressure. So oftentimes people feel no symptoms at all from having high blood pressure, which is why it's so important to make sure that you're following up with your doctor and keeping on top of that. And the goal numbers that we tend to target, I usually recommend that we try to keep blood pressure with medication in the 120s systolic, which is the top number, or the 80s or less than 80, and that diastolic blood pressure, which is the bottom number. So 120s over less than 80 would be the target numbers. I think that for most patients are going to be the best results.
Okay. Why is obesity a risk factor?
So obesity does a lot of things to your body. One of the things it does is it can raise that blood pressure. It can put an additional strain on your heart. In anything that's increasing the amount of work that your heart has to do is going to increase your risk for heart complications down the road. So I think of it as, there's that one aspect of just the extra effort that your heart's putting forward to pump against higher blood pressure, to get your body moving when there's that extra weight on board. The other aspect of obesity that we worry about with heart disease risk is with metabolic syndrome, so meaning diabetes, cholesterol, kind of all getting out of control with obesity. So the good news with that is that even small reductions in weight, even 10 pounds of weight loss, can really make a dramatic impact in blood pressure, in cholesterol, and in the amount of effort and strain going on with your heart.
Okay, thank you. So what would you recommend to our viewers who aren't at that desired weight? What would you recommend that they do to get to that weight that they're looking to achieve?
Yeah, so it can be really hard, I think, for a lot of people to lose weight, and if you're successful in losing weight, to keep the weight off, which is often the most difficult part. But I think that the way that ultimately weight loss is achieved has to do with the balance between the calories that are taken in during the day and the calories that are burned. So really, there are a lot of different diets out there, and some may work for some people, but it ultimately comes down to the number of calories taken in. So you should, as an individual, kind of talk with your doctor about what's recommended for you, because that certainly varies based on patient's age and gender and their current weight as well. But certainly calorie restriction at the end of the day is going to be the most effective way to lose weight and to maintain that weight loss. Exercise can be very helpful as an adjunctive therapy or adjunctive strategy, but it's not in and of itself enough. It has to be also done in conjunction with dietary changes to maintain and achieve that weight loss.
Yeah. Just piggybacking on that, I think it's really important that when we're talking with someone about weight loss, that it's individualized to the person, because different people will approach this in different ways. Some people want to just totally have a clean slate, and they'll go onto a diet that's totally different than what they're used to, and that works for some people. For a lot of people, I would say that the majority of people that I talk with, that's really too hard to do, because there's so much wrapped into food, culture, social gatherings, that sort of thing. And so it's much easier, like Dr. Dooley was saying, to reduce the calories a little bit rather than changing everything about what you eat. just because it's really hard to go on some diets depending on a certain person's situation. So we really try to individualize that and work with people.
Great. So we've covered a lot of different risk factors: smoking, obesity. Let's talk about one more: diabetes. How does that raise your risk for heart disease?
Sure. So diabetes, unfortunately, really increases your risk for cardiovascular disease through a number of different actions, and I lump it into that metabolic part of obesity, where your body is having trouble handling its sugars, and that's putting some inflammation on your blood vessels, and then leading to problems with the kidneys, and it kind of triggers this whole cascade of vascular issues. So unfortunately with diabetes, it is something where we really have to stay on top of it. Again, the great news with diabetes is that when it's well controlled, when we have some medications, lifestyle things that keep diabetes under good control, it can reduce that inflammation, that injury onto the blood vessels, and really let people have normal, healthy lives. So the big thing with diabetes is keeping it under control so that we don't let it really get out of control and injure the blood vessels and heart.
Great. So that's all the questions that I have for you today. Before we wrap up, is there anything else you'd like to share with our viewers before we conclude our broadcast?
I think the only other thing that I would sort of add to all of this is that a lot of the things that we're discussing are certainly really useful information in terms of thinking about a general population level, but I think it's really important to remember that all these things are sort of generalities, and so talking with your doctor about what works for you in all of these things and what strategies are recommended for you is really going to be the most important thing, I think, to take away from all of this, because everything is individualized. And when we see patients in the office, I know Dr. Paivanas and myself and all of our partners, we really tailor our recommendations to individual patients and what's going on with that patient, what might work with them, and what might work for them. So I think that's one of the more important things to kind of keep in mind when we're thinking about all these recommendations for preventing heart disease and staying healthy.
Yeah, sure. Absolutely.
All right. Well, thank you very much for joining us today. We hope you learned something today about heart disease. If you would like any more information or would like to make an appointment with Dr. Paivanas or Dr. Dooley, please call 410-573-6480. Thank you very much.